Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone. It's Donna Corriel, and I'm here for yet another episode of Entrepreneurship in Healthcare. And this time, I have Dr. Michael Hersh sitting across from me virtually. And Dr. Hersh, welcome. I'm going to have you introduce yourself, and then we'll ask you the question of the hour.
Well, thank you. First of all, thank you so much for having me here. It is great to be here chatting with you. You and I have had an opportunity to chat in the past, and it's always been such a great conversation. So I'm looking forward to chatting with you again today. A little bit about me. So I am a mid-career, full-time practicing gastroenterologist. So I've been out of training for about 15 years now. And I've been in the same practice. I live in Chicago. I work in the suburbs. And when I came out of training, it was a very small multi-specialty group. There was about like 30 to 40 doctors, mostly primary care. And over the last 15 years, I've seen such a tremendous change. So it's same job and so many changes in what that job has looked like. And so for me, as I've experienced all those changes, I have also changed and I experienced all the things that go along with it, the frustration and the bureaucracy and the trying to figure out what's next and feeling stuck in the clinical work. And also noticing, so I'm married and I've got two young children, and I had created for myself the picture of what I had always wanted, right? I had brought to fruition all of the things that I had ever wanted. And then I found myself kind of wondering, like, well, where do I go from here? What's next? And so for me, and I know we're going to talk about entrepreneurship, but that ended up being part of the thing that I found that really filled in the answer of what's next for me. We can certainly talk more about it, but I think I had a lot of thoughts about entrepreneurship. And probably the prevailing one is this is not what a good doctor does. A good doctor continues to practice clinically, stays focused on patient care, and doesn't look outside of medicine for other things. And it was something that it was a thought I didn't realize was there. And it took a lot of work to kind of chisel away at that belief. Because I think that there's so much that entrepreneurship brings to the table that brings fulfillment back into our lives. And for me, has enabled me to continue practicing clinically.
Incredible. So you've already answered the question, but I'm going to ask it anyway. So just to kick off this episode, entrepreneurship in healthcare, good or bad?
Yeah. Well, I think I've already made my opinion clear, which is definitely good. And maybe I have a little bit of a different perspective than other people on this, but I think what I heard just throughout my medical education and clinical career is that doctors are bad at business. So we are told over and over again that doctors should just do what we are good at, what we are trained to do, and that's stay in your lane, essentially. And I think that I believed it, right? Like all things in life, you're told something over and over again, and you start to believe it. Doctors are bad at business. Um, and what I have found is that couldn't be further from the truth. I think healthcare has changed, and understanding the business of healthcare has changed. But I don't think that means that doctors are bad at business. I think that we all have the ability to learn. We are high achievers. We are determined. We are motivated, and we can learn anything that we put our minds to. So I think just a blanket statement of doctors are bad at business holds us back. And if you're willing to learn, if you're willing to try, if you're willing to fail, which I think is really important in entrepreneurship, then you can get good at anything that you want.
I couldn't agree more. Um, I definitely agree with the whole stay in your lane mentality. I think that we've sort of been fed this line as we go through the steps of becoming a doctor, which is why it was so important for me to open up that student section of SoMeDocs. I do want to not only myself connect with the students where they are because I've been there, but because everyone else within SoMeDocs, yourself included, has been there as well and has so much to share with them. To those listening, Dr. Michael Hersh is a network member. So first of all, want to say thank you to you for believing in what we do and being a part of the community. But also just a big thanks to the community in general for being there and for, most of them are taking on this mindset, at least the mindset of being an entrepreneur as a physician, no matter what steps they're going to take. That's the beautiful part of it, is that entrepreneurship means different things to different people. And each of us are sort of taking our skills and our talents and what we're really both good at and are interested at, and really expanding it into something else. So, with that said, tell us a little bit more about how you've embraced entrepreneurship and what specifically you've done.
Yeah. So I first and foremost, I think it's important to recognize all of those things that I was just telling you that were holding me back in my life, feeling stuck, wondering about what's next, wondering if I deserved anything more. I already had such a full life. I had already achieved all of the things that I had ever wanted. Why in the world do I deserve to be asking for more? And I think that that is really common for doctors. We're like, I've already gotten all the things. Why should I be asking for more? And I think, if your children ever came to you and they were like, Mom, Dad, I've already achieved so much more in my life, but I want to try this other thing. Would you ever do anything other than encourage them to continue to pursue their dreams? Yet when it comes to ourselves, we're like, no, no, that's enough. You've done enough, right? And so I think for me, I found physician coaching as a burned out physician who was racing for the exits, trying to escape clinical medicine. I didn't see how I could continue doing this for the rest of my life. And when I started to question some of these underlying thoughts and beliefs, I was able to begin to unravel, okay, well, this is why you're holding yourself back. And so for me, I then, as somebody who was receiving coaching, was like, oh, maybe I will get a coach certification. I just want to learn these tools in a little more depth. And what I saw as I continued on was that there were so few male physicians who were out in the world talking about the benefits, talking about how you don't have to escape medicine to be happy. And so even though it was incredibly uncomfortable, even though I am not an extrovert who loves to put myself out in front of the world, I leaned into all of those discomforts and I started a business. I started Better Physician Life Coaching. And I kind of didn't really know what was going to happen, what it was going to be, but I just thought, at least I'll be out there talking about it. And what I found in that process of doing that uncomfortable thing of getting an LLC, talking to my employer about this thing that I wanted to do in my own time, on my own hours, was that leaning into the discomfort started bringing all of this fulfillment into my life that wasn't previously there. Yes, I get a lot of fulfillment from doing my clinical work. And yes, I love what I do. I love seeing patients in clinic. I love the procedures. And there was a part of the fulfillment that was missing, which was the constant growth and development and pushing myself to try new things. And I've said it before, but I'm going to say it again, and then failing publicly and picking myself up, supporting myself, and moving forward. And I think that's where all of the benefit has been. And then also just touching on your SoMeDocs and the community. Oh my goodness, that was such a missing piece for me as I was kind of struggling in my clinical career. I think we're all so used to having this community when we're in our training, and then we get thrust out into the world without any support system, without any structure. And so finding communities like SoMeDocs where I could be around other like-minded people, where I could be exploring things that other people had already tried and done and get expert advice and opinions, man, did that make all the difference for me.
Yeah, communities are really everything, especially when you are entrepreneurially minded. And I think that a lot of physicians are practice when they're attendings, when they become attendings, they do practice sort of alone. I think it does get lonely and we sort of get into a rut. And the fact that there's so much dissatisfaction in our profession. Some people call it burnout. We were talking about that right before we hit recording. We hit the record button. Just that term is just not such a great term for something that we are all really experiencing. But many doctors today are whether it's dissatisfied or unhappy with the way medicine is, they just need something else. And in my opinion, entrepreneurship really sometimes can help, at least in redefining how they practice medicine, or maybe just finding something else that they want to do. And again, we have a Doctor Side Ventures that's been growing out of SoMeDocs that can help doctors kind of find a side venture that's interesting to them. You've definitely dabbled in side ventures. I mean, clearly we can have you on an episode in that series as well. But I know that you did like a short podcast series. Can you tell us quickly about that? And I know that you were co-hosting it, so you can tell us about your co-host as well.
Absolutely. Yeah. So Dr. Arpita Gupta DePalma and I co-hosted a podcast called Doctors Living Deliberately. And we did it for a year. We were consistent recording episodes every week for a year. And it was also one of those opportunities where I didn't think that this was ever going to be me. I remember listening to my first podcast maybe 10 years ago and thinking like, oh, I love listening to these, and never dreamed of a time where I would be the person that I would be listening to while I commuted to work in the morning. So Doctors Living Deliberately, what we were doing is we were bringing doctors on that were taking charge of their life, living with intention and purpose, and showing, with the goal of showing other doctors, look at what your amazing colleagues are accomplishing. With again, the purpose being that so many times we limit ourselves and what we think is possible for ourselves. And sometimes not from a place of comparison, but from a place of opportunity, seeing what our colleagues are accomplishing and achieving and allowing that to open doors for ourselves, crack open maybe just a little bit those limiting beliefs that tell us we can't do something or we shouldn't do something. It was an amazing experience. And I learned so much about our colleagues, but I also learned so much about myself in the process of what I was capable of, what I could do, and definitely got bit by the podcasting bug. So I think from a Doctors Living Deliberately standpoint, I think it had run its course. And so we decided to pause it after a year. But do I think I'm done with podcasting? Probably not.
I hear you completely, and definitely as a creator that really appreciates building things and varying it up, I'll say. Take the SoMeDoc series, for example. I too, with my SoMeDoc series, have different kinds of shows. Um, and again, people have different priorities and different availabilities. So I'm totally understanding of folks, our colleagues that keep going with their podcast. But I personally sort of love exploring different aspects of, whether it's entrepreneurship or healthcare or side ventures or dissecting social media. I just really love that. And I love that you're giving yourself a chance to do something different now that the year is over. Was that something that you planned ahead of time, that you would go for a year and then reassess? Or is that something that you both just kind of came to and said, you know what, this is not giving us back what we wanted it to give back to us. Let's pivot.
Yeah. I think it was a little bit of a combination. I think as Doctors Living Deliberately, right, and trying to live into the name of the show, we were coming back and assessing like, what is it? How is this working for us? How is this? And from scheduling standpoints and things like that, it was challenging. It's a genuine commitment. And I want to highlight one of the things that you were just saying, right? So many physicians believe that once they've committed to do something, that they have to continue to do it in perpetuity, that until they receive like a cease and desist, that they have to just go, go, go. And I think what we also wanted to demonstrate to our audience was that you can decide, like, okay, like I've done what I came here to do. This part of my journey has completed itself, and I can continue to go on in other directions. So many doctors want a prescription that allows them to step away from something that they're already doing.
We'll be right back. Hey everyone, Donna Corriel from SoMeDocs. SoMeDocs has just newly released its Side Venture series. It joins a stellar lineup of other fabulous video and podcast series, including Entrepreneurship in Healthcare, SoMeDocs Conversations, and more. In fact, we're working with our members to create more interesting and unique shows to share with you. But if you're interested in side ventures, we do also have a Facebook group that's been built just for doctors that are curious on what else. Check out the Facebook groups that we manage at doctorsonsocialmedia.com/our-facebook-groups. I'll see you there. Back to our show.
So many doctors want a prescription that allows them to step away from something that they're already doing. And we wanted to basically fill that out for our audience and be like, look, here you go. You now have our permission to decide that the thing that you're doing is done from a place of understanding and love and compassion for yourself, just that you're going to use that time to do something else.
I love talking about this topic in general. Just it's not necessarily a failure when you close something up. It's all, of course, in the perspective. You can also fail at something legitimately and still learn from it and still have it serve as a positive part of your life. So I do feel like, closing things up and moving on is a learning lesson for us all. And we probably can name many parts of our lives, even the successful ones of us, right? I mean, most people I have on the show are physicians. And so in and of that, is the fact that they are successful because they've gone through such an arduous path. So that in and of itself is a success. And you're allowed to, from there, sort of pivot and look for different things that you want to do, whether you stay in medicine or you don't. Now, we spoke about this before we hit record as well, and is that you're still a full-time physician and a gastroenterologist at that. So that's really laud-worthy, like amazing. How do you juggle everything and still keep a full-time job?
Yeah. I have a very supportive wife, a very, very supportive wife. So, I think, there was a point in my career where I was very unintentional about how I structured my clinical day. I was trained that, say, from a procedural standpoint, that you start doing procedures at 7:30 in the morning and you finish at 5 p.m. and there are no breaks and there are no meals and you squeeze things in when you can squeeze things in. And if there is somebody that needs to be seen, you add them on, and you don't leave spots in your schedule for these add-ons. You just add them on. And I think what coaching has done for me was led me to be much more intentional with how I use my time. And it hasn't been easy. There's been pushbacks. There's been my own discomfort at asking for things that I wasn't sure I deserved or should get. And then when you take a step back and you're like, well, of course I deserve a 30-minute break in my endoscopy day to eat lunch, to have 30 minutes to myself so that I can show up for my afternoon patients the same way I was showing up for my morning patients. And so one of the ways that I have been able to accomplish this is by creating clear boundaries that allow me to practice clinically in a way that feels good to me and that allows my patients to continue to get excellent care. And then, from a business standpoint, creating specific times where I'm working on my business and making sure that I'm also available to pick my kids up from school once in a while.
It's so interesting as I run these episodes that there's like this recurring theme that's almost like underlying. It's not something that's said out loud. And that's this like indoctrination that doctors get through this journey that we're on. And what I mean is that there's this indoctrination that you were touching on of almost like having to say yes to everything and almost like sometimes bordering being abused because we kept having to say yes to everything. And then coming out at the end, meaning when we do become attendings from residency and kind of having been indoctrinated, feeling that need to always be on the go and never give ourselves permission to pause and permission to say no, or permission to take on, like you said, something new, or even permission to fail. I think that, it also doesn't help that we're dealing with human life and human bodies. So obviously that's an area where we cannot fail. I think that we sometimes erroneously apply that to other uh, sectors of our lives, and we don't give ourselves permission to fail or to pivot or, to kind of go off of script.
Yeah. And I want to add one thing to what you were just saying, which is we think that by saying yes all of the time, where it's so much easier than saying no. And what is so important to remind the audience here is every time you say yes to something, you're saying no to something else. And each time you say something, yes to something in your clinical career that you don't actually want to be doing, the person you're saying no to is you. And so how can you balance that out so that you start saying yes to yourself?
Totally. And I'm actually laughing. Some people are going to be listening to this, so they can't see me smiling, but I'm smiling to myself because also I've had episodes where, for example, we had Amanda Kane on. She's starting her medical school, and she was talking about how she had said no a lot and that she's trying to kind of push past that and say yes to more opportunities. Let's listen to just a short segment from the Amanda Kane episode, and you can find the link in our show notes.
I wasn't able to see the light because I was just in my room and I was just studying, and that was my life. And now that every opportunity I get to go do something fun, I'm yes, 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 like let me do it. And I think that's allowed me to kind of see the light in life, and that there's so much more to life than just medicine too.
Okay, back to our conversation with Dr. Hersh. So I'm kind of laughing to myself because you can sort of argue both of those, right? Like you need to say yes more. No, you need to say no more. Like life is tough like that. And I think that that's the bottom line, is that we really do need to just weigh each proposition according to where we are in our life and according to whether it's going to add anything to our lives and make us happy. Is this something that you have to do? Is your employer making you do this? Are they even allowed to make you do this? And is this going to serve a good purpose for yourself? And again, allowed to say yes or no, especially when we are adults and we are free thinking. So what an exciting kind of thing to say out loud and for doctors to be listening to.
Yeah, and there may be a little bit of a generational component to that as well. As a Gen Xer, we were just taught to just say yes, take every opportunity. We watched our parents like work, 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 and so that a lot of that was indoctrinated into us. And I can see with my own kids, like they have no problem saying no, right? Like they say no to things all the time, things I never would have said no to my parents for. And so some of that may be generational. And I think, when you're talking about balancing the yeses and the nos, it's really about what aligns for you. So, saying yes to opportunities, absolutely, so long as those opportunities are aligning with your overall goals. But just continually saying yes every time every time someone asks you to do something is a surefire path to setting up a life of unintention and not getting you what you want.
Totally. I think that again, it's just all dependent on, the context of the proposition. And I think that again, that's why communities are so important. Sometimes we can't always decide for ourselves. And some of us are maybe, lucky to have employed maybe a coach. I mean, I've never done it, but I know that others do, and others believe that it really does help. But it also helps to just have a community to sometimes bounce something off of. I mean, SoMeDocs certainly has several Facebook communities where doctors are not only sharing with one another what they're going through, but they can also do so anonymously, so as to not give away their identity. Super interesting. So bottom line, you think entrepreneurship is good for the most part. Let me ask you something. Is there ever an instance that you can think of where entrepreneurship can be bad?
Well, I think so many doctors are struggling with, checking their charts in the evenings and on the weekends, and have trouble shutting their brain off when it comes to their clinical work when they're outside of work. Well, entrepreneurship, you're never not an entrepreneur. Your business is always there. And so depending on what it is that you are trying to do, if you are trying to be active on social media, promoting the work that you're doing, or if you're trying to respond to your clients or whatever, it's always there. And so for sure, if you are a doctor that is burned out by the ubiquity of clinical care, you can certainly get swept up in, entrepreneurship as well. And so I just think as we learn to create boundaries, like we were just talking about, making sure that you are creating them for your own entrepreneurial journey as well. Otherwise, it will just consume you just like medicine has.
Absolutely. Here to that. All right. So with that, I think that we are going to wrap this really great episode up. So first of all, I thank you for joining me here. The second thing is, would you like to leave us with an ask?
Yeah. Thank you so much for having me. I loved this conversation. It was so good. And hopefully so many takeaways for your audience. If you would like to connect with me, you can find me on all the socials. My favorite is LinkedIn. And by the way, doctors, I had this very ingrained belief that LinkedIn was not for physicians. And I have found some of the most supportive physicians on LinkedIn. It's such an incredible community. And it was SoMeDocs that helped me find my way on LinkedIn. So shout out to SoMeDocs and the work that you guys are doing on both LinkedIn. I know you're very big on Instagram as well. So please, come find me on LinkedIn, connect. You can also connect with me on Instagram and Facebook, betterphysicianlife.com. And I do have on my website some tools to help physicians figure out what's next. A video and a worksheet that people can use to help them sort through what's next in their journey. So that's www.betterphysicianlife.com. And yeah, again, thank you so much for having me. It's been a blast.
Of course, and there will be show notes underneath, and your profile will, of course, be linked on it. Where the SoMeDocs profile, where your website and all social media handles are as well. The other last thing I want to just mention is that we have a new LinkedIn blueprint for those of you that are listening that you can opt into. I'll tag it also underneath in the show notes, but that's where you can sort of get a 5-day help, I guess, emails on how to perfect your LinkedIn profile if you're just getting into it. And there's also now a profile builder package that you can purchase through our site to get hands-on help in creating your profile so that you really do maximize and optimize your LinkedIn presence. So I'd like to say again, one last thank you to Dr. Michael Hersh, and thank you to those of you listening. If you've loved this episode specifically, please don't hesitate to like it, to share it, to rate it, and to do everything else that's supportive, and to, of course, subscribe to SoMeDocs, and we will see you soon. Thanks so much for listening.